You so much. Thank you all, everyone who has joined us this evening for our prostate cancer awareness. Let's talk about it webinar. Thank you all for being present. This is going to be an informative discussion about a topic that we need to talk about. So, this evening's agenda consists of a welcome and housekeeping, introduction of our speakers, then we're going to do the workshop presentation, Q&A, a raffle, and then closing. So quickly, housekeeping, this workshop is being recorded. Please keep your mics on mute, ask questions, but if there's something that you have that you're, needing to be answered quickly, please use the chat box. We will have a moment where you can actually unmute yourselves and ask questions, but if there's something that's hitting you right there in the moment, just put it in the chat. Try to get to it. And also, we'll be dropping the survey in our. I'm sorry, I got something that popped up on the screen. So we'll be dropping the survey in. So if you're unable to complete the survey while we are doing the workshop, no worries, because I will send out a follow-up email that'll allow you to do the survey. And again, we're going to do our live raffle. So stick around. We're going to do the live raffle. You get a chance to win a great prize. So please follow us on social media at UCM Urban Health Initiative. We are on Facebook, Instagram, and we have a YouTube page. So upcoming events, those will be announced soon. So that's something that you can also receive when you sign up to receive our biweekly newsletter. So just a little bit about us. We are the Urban Health Initiative, the Office of Community Affairs, which is UChicago Medicine's health division, responsible for collaborating with community-based organizations on health-related programs, research, and services for residents on the south side of Chicago. And some of our programming includes health and wellness programs, healthcare career fairs, sponsorship events, WVON radio show, which is on AM 1690 every Saturday, community newsletters, which are biweekly, free fitness classes, and volunteer opportunities. So let's meet our speakers. So up first, we have Dr. Carol Campbell, who's our emergency med resident. Dr. Campbell is a second-year emergency medicine resident at UChicago Medicine. She is extremely passionate about increasing access to quality care and improving health literacy, specifically in systemically excluded populations such as the South Side of Chicago. Thank you so much, Dr. Carol Campbell. So I'm going to pause this right here. We also have our prostate cancer survivor, Mr. Arnold Romeo, who will share his story with us. So please stick around to hear that. So I'm going to turn it over to Dr. Campbell.
Yes. Sounds good. Good evening, everyone. Just give me 2 seconds to pull up my slideshow here. The Arlington Heights Police Department turned off the data sharing function on its camera system called Plug Safety. All right, and can everyone see this and hear me as well?
Yes.
Perfect. So again, my name is Dr. Carol Campbell. I am an emergency medicine doctor, so I do work in the emergency department. Very happy today to be speaking with you all about prostate cancer, sharing some information about that. My hope is that all of you learn at least one piece of information that you're able to retain, remember, but also share with friends, family, your loved ones, just so that we can spread around important and factual information for the health of everyone. Just a small piece about me. I am from the west suburbs, Maywood to be exact, born and raised. I spent some time in Michigan for college, Ohio for medical school, and happily came back here to Chicago to complete my residency training. I have 1 year left remaining, but I will be practicing emergency medicine full time. And just a disclaimer here, in the emergency department, we do see lots of different things, lots of different medical illnesses, early onset prostate issues to be one of them. However, in the event that you are having difficulties and strong concern in terms of prostate cancer, et cetera, your main physicians would be a urologist as well as an oncologist. So I'm just here to essentially spread some broad information, some tips and tricks, some early intro information in terms of just to get everyone started and made aware of some broad things. So I'll go ahead and get started here. So, things that we'll speak about today is essentially we think about prostate cancer, but talking about what exactly the prostate is, what is prostate cancer, just some risk factors, symptoms, some screening guidelines in terms of how we're able to kind of figure out if this kind of fits your symptoms, diagnosis and treatment, and then finally just some take home points that I hope that you all are able to bring back to other folks. So, what is the prostate? The prostate is a small gland about the size of a walnut or a golf ball that is found only in males. And the purpose of this gland is to make up a portion of the fluid that produces semen. It's located below the bladder, but directly in front of the rectum. So you can kind of see here in this picture here, this is the gland that I'm pointing at here. This is the rectum that is right behind it. And so it sits right under the bladder and right in front of the rectum here. And what equates to prostate cancer is when the cells in the prostate itself essentially start to grow out of control and expand. And that's essentially what we deem as malignancy. So just some broad statistics that we have here for cancer. It's actually the second leading cause of cancer death in men in the United States. About 1 in 8 men will develop prostate cancer in their lifetime. However, it does have a 97% 5 year survival rate. So typically 5 years after people are diagnosed with prostate cancer, 90% of them are still surviving within those 5 years. Now let's talk about some risk factors, some things that essentially put you at higher risk for developing prostate cancer. We typically see it in males that are greater than the age of 50, as well as this can also be a genetic component to it as well. So if you have a strong family history of prostate cancer, dads, uncles, grandparents, etc., that does also put you at a higher level or a higher risk, I should say, for developing prostate cancer, as well as lifestyle. There's not a lot of research in terms of lifestyle. However, there's a small amount of research that does say that your lifestyle in terms of your level of activity, your diet, as well as your genetic makeup in terms of if you are obese at the time, can contribute to prostate cancer as well. And then also ethnicity. There is a higher incidence or a higher level of cases of prostate cancer that we do see in Black men. It's actually 70% higher in the Black male population than the white male population, as well as mortality or death rates are actually 2 to 4 times higher in the Black male population. And we're not sure exactly why that is, but statistics is showing this significantly higher rates in our male Black population. And so, just some symptoms. I know a lot of people are very curious to know what I should be looking out for, etc. Many people, unfortunately, don't experience symptoms at all. And just listed here are a few symptoms that some people may have. This includes like pain with urination, if you feel that you're using the restroom more frequently than normal, or having difficulty urinating, where if you feel the urge that you do have to urinate, but you're really unable to kind of start that or initiate that. If you tend to see any blood in your urine or your semen, or even it could be something as simple as pain in your lower back. Now, I do want to preface this preface with saying that some of these symptoms may also be caused by other things, right? So I don't want you all to think if you are having these symptoms that this automatically may be prostate cancer, but definitely something to seek medical assistance, at least starting with like your primary care physician, if you're unable to obtain an appointment with that, your urgent care, and of course, if you think this is more urgent or emergency department as well. So just as a preface, that some people don't experience symptoms at all. Listed above here are some symptoms that people may experience. However, these symptoms listed above may also be caused by medical conditions that are completely outside of prostate cancer. For example, urinary tract infection. Okay. Now, in terms of screenings, the prostate specific antigen test, I'm not sure if any of you all have heard of a PSA, but this is one of the screening tests that we can typically do to lead us in the direction or not if people are or medical providers are concerned that you may be on the route to prostate cancer. So the PSA test is essentially a screening test to look for those signs. It can help identify cancer early on. However, it is not a diagnostic test. And essentially what that means is that if your PSA or your prostate specific antigen result comes back elevated, that does not automatically mean that you have prostate cancer. Okay. I like to think of this test as a warning signal. If that number does come back elevated, then that essentially means that we need to proceed down the route of completing more testing. Okay. And so a higher PSA or prostate specific antigen test is a bit alarming for us. However, if you look to the right here, you can see that there are additional causes of elevated PSAs. For example, as people age, their PSA levels will naturally increase. If you happen to have a larger prostate, your PSA level can also be elevated. Certain medications can also impact this number, as well as if you have an infection in that area, such as prostatitis, which is just inflammation or irritation to the prostate gland, as well as if you are a participant in activities that essentially manually places pressure on that prostate gland. So if you can imagine someone who rides bikes often, who goes horseback riding, that constant pressure very frequently can also cause that PSA number to be elevated. And so again, this is just like a warning sign that essentially lets us know that more testing needs to be done. But this is not an end all be all or a diagnostic test for us. Another screening exam that it kind of depends on the medical provider, it depends on the patient. Sometimes they will offer a digital rectal exam. I'm aware that this is not the most comfortable exam, but this is when the provider will manually have to feel your prostate, essentially to feel for abnormalities. Sometimes this is useful more so for patients who are having symptoms. Whereas the medical provider is able to physically feel or touch the prostate to see if it feels abnormal or not. The prostate should feel like the texture if you were to press the tip of your nose. And sometimes you can feel if there is any irregularities, if it's not as smooth, if it's rough, etc. So sometimes that will also be recommended for patients as well. So we're talking about the types of screening tests, but let's talk about when you essentially it's recommended to start these tests. Typically, starting at the age of 50, your primary care doctor will start having conversations with you about offering these screening tests, such as the PSA. Now, all of this is in the setting of understanding the individual's preferences and values. For example, some patients are not interested in knowing if they may or may not have prostate cancer. Some patients also are under the mindset that if they do have prostate cancer, they would never seek any further treatment. And so they would rather not know or go down the screening process. And so it really depends on how each individual feels. But around the age of 50 is when providers typically have the conversations about offering these tests. After the age of 70, we typically don't recommend routine screening. Routine would be every year or two, and that's typically, again, secondary to people's preferences, values. Of course, if you are over the age of 70, you are interested in this is definitely something that you can speak with your primary care doctor about, but we typically don't routinely screen, specifically because if after the age of from 50 to 69, you've already been offered this several times, and if you were to take them up on that. You've had several negative or positive screenings to that point. However, again, if that is something that you're interested in and you are over the age of 70, absolutely, I implore you to advocate for yourself and reach out to your primary care physician stating that this is something that you're interested in. Separately, if you are a part of the high risk groups, if you are a Black male, if you do have a very strong family history of prostate cancer in any of your close male relatives, I would initiate those conversations at the ages between 40 and 45. So I think it's very important that when you do meet with your primary care doctor, they tend to ask what your family history is. And the purpose of that is for them to essentially be able to tease out who may need screening at an earlier age because these people may benefit from more frequent screenings and, of course, at an earlier age just to keep a closer view because there is a genetic component to this as well. Now, let's just say your PSA is elevated. Now what? What do we do? The number one thing is to discuss this with your primary care provider. They will likely repeat that PSA test because of the other possible causes that we spoke about, right? So we want to make sure that it is not your activities that you're a horseback rider that's causing this. We want to make sure that it's not a medication that you're taking that's causing this PSA test, okay? So if you do get the repeat PSA test, if it is elevated, if it is going up, then we typically recommend an MRI. And an MRI will give us the best picture of the prostate to essentially let us know if we see any lesions or spots or cells that look concerning for cancer. Now, if you have a negative MRI with that elevated PSA test, we essentially watch you for 1 year and you'll get a repeat MRI. If your MRI is positive, for possible suspicious lesion, suspicion for cancer, then that's when we elect for a prostate biopsy, where it's a small procedure where they will surgically take a piece of the prostate to look under the cells more closely to see if they do think it's cancerous or not. Now, listed here are some possible treatment options. I do want to let you all know that this is all varies by case, by person, essentially by your PSA level, by the MRI, by the biopsy results. So there is no one size fits all. But some of the options can be surgical removal of the prostate, radiation therapy, hormonal therapy, as well as chemotherapy. There are also some events where if the prostate cancer is caught in a very early stage, that surveillance is recommended just because the risk and benefits and the side effects of all of these treatments that I've listed here may outweigh the benefits. And so, just some take home points here, just before I wrap up, is that I hope that you all are at least able to take a couple things from this presentation here, and that you are able to encourage the men around you that you love, that you care about, to routinely visit their primary care doctors. If they don't have one, let's encourage them to at least start the process of getting one, just so they can speak about their personal risks for prostate cancer, their preferences, their values in terms of if they do want to entertain the options for screening, and then as well as the pros and cons for prostate cancer detection and treatment as well. So I implore you to share what you learned today with others, even if it's just the risk factors, the symptoms, and screening options. Thank you so much. I hope you learned something. And I will turn it back over to Mrs. Massey if you all don't have any questions.
Thank you so much. Excellent presentation. Does anyone have any questions for the doctor? She provided some really great information here. So if you would like to ask your questions now, please go ahead. If not, we will go ahead and move forward with our next speaker. Oh, sorry, I'm not even on camera. Okay. Yep. So, okay. So we will go ahead and move forward with Mr. Arnold Romeo, who is going to speak from personal experience. So, Mr. Romeo, take it away.
Good afternoon, everyone. Good afternoon, everyone. My name is Arnold Romeo. I am a prostate cancer survivor, and I am thankful for all of. It was funny as I was listening to you, Doc. It's like I've been down a lot of that road, and so thank you for an excellent presentation. It's wonderful. Um, so one of the things that I will start out by saying is that keep the doctor's presentation. It was recorded. I would keep it. I would keep it on my phone. If you're an African American male, if you are an African American who has males in your family, uh, so keep that information, share that information, simply because it's not something that we know about. And while the doc has said some things, I would encourage some other things in my life because as I was listening, the people who they have diet issues, obesity, and sedentary lifestyle. And I didn't do very badly in the diet area. Um, I am diagnosed. I was diagnosed as obese, and you would be surprised that that's not for African American men. That's not a that's not a that's not a high number for us. I weigh 200 and now I'm right around 235 pounds, and that was today because I weigh every day now. Um, and but I lived a sedentary lifestyle. I worked in an office for most of my years. I worked for 45 years, but most of those years I was in an office and primarily sitting. Um, Before I was sitting at a computer, I was sitting at a desk and working at a typewriter and those things. I was managing in an office and all of those things, but bottom line is it was sedentary. I didn't do a lot of exercising. And so I would encourage exercising. Walk every day if you can. Walk. Park the car at the end of the parking lot and walk to the grocery store. Walk to the place where you're going to. But do everything you can. Go up some stairs sometimes, because those are the things that I didn't do, and I believe that those are the things that help contribute. Because I'm not a smoker. Uh, I did not. I was not a alcohol drinker. Or, I mean, I had alcohol when I was a younger person, but once I got to be a grown person, to so to speak, very little of that. But I think one of the things that's most important is that last slide. Um, you know, to according to whatever, like I said, it takes a village in our community. And so if women, ladies, if there's somebody you love, you like, in your life, encourage them. Encourage them as a black male to go and see the doctor. Those who don't want to, they say they're not interested. I would say ask them, encourage them, even though they say they're not interested. Because the bottom line is, when it gets to be bad enough, there is nothing that can be done. If you get to a point where surgery is not going to help you, then they'll give you your life expectancy, and that's it. And so, I encourage doing it now. Um, I uh, I was diagnosed. My doctor and my primary care doctor, I'm a patient in the University of Chicago. My primary care doctor had me doing PSAs, and during COVID, I missed two PSAs, and so I didn't go, and my prostate went from my PSA went from 4 to, I want to say, 6, and I then, at the end of, this is in 2021, the end of 2021, I had the MRI, and diagnosed, with prostate cancer. Had two, talked to the surgeon and talked to the oncologist concerning radiation treatment. I want to encourage, and I'm going to keep coming back to this because I think this is truly important. Um, have some alacrity about it. If you go and somebody says your prostate is elevating, talk to someone and find out why. Find out what they can tell you, and you have to, as I would say, for the village to advocate for the person. The person needs to advocate for themselves, but if they're not, then the village needs to. So take take your men to get their test. Take your men to find out why their their prostate is your PSA is elevated, because you, as the person in the family who are closest to them, you are the one that has the most influence. So work on your circle of influence and get your circle of influence to go get them an advocate. Ask. If you're not getting a satisfactory answer, ask. And don't just ask, but the internet has everything that you can think of to find out about medical issues. Look it up. The Mayo Clinic uh, has information you can call. You can go to their website. Other places do, but the point I'm making is get into the business about it, because I feel, as I look back, hindsight being 2020 for me, if I had addressed it in 2020, if I addressed it in my COVID years, I probably would not have had to go through all of what I went through, because by the time I got to in December of 2021, by the time I got the diagnosis, and this was the other issue, it was getting to the doctors. It takes time to get an appointment, and so you have to push. You have to make your appointments. And so by the time I got to the doctor, I didn't get to one doctor until the end of January. And this happened on December the 10th. I didn't get to a doctor until the end of January. My surgeon asked for a consultation. I went for the consultation, and there was issues with that. And so I kept calling the doctor's office. I was like, I need to talk to the doctor. I'm looking at my my numbers and things are getting bad. I need to get an answer. So by the time I got surgery, my prostate was removed, but there was still cancer in my lymph nodes. And cancer being in my lymph nodes, that meant I did have to turn around and get um, the and get a treatment for you know radiation. And so I ended up having to go and get 37 days of radiation treatment, and so that all of the cancer that was in the lymph nodes could be killed. But it also left me with some issues. Um, it affects my bone density, because you then go from cancer treatment, you didn't go from the radiation treatment, and I opted to go into a cancer study, um, and get hormonal treatment. And so I've done 2 years of hormonal treatment. That affects your bones, that affects the strength of your bones. Uh, and so I'm also diabetic, and that contributes to how I manage my cancer, and and what and the fact that that can cause my cancer to come back if I don't manage my diabetes properly. That will happen. And so I don't know how much time I have left, but I have a couple more points I want to make. And so um, the um, the high risk, 40 to 45, I would start making sure that everybody in the family who could be at risk, one, making sure that younger people are exercising, they're walking. You can walk. You don't have to run. You don't have to do all those other things, but walk a mile a day. Walk a mile a day. There's nothing wrong with that. It's 8 blocks. If you walk 8 blocks, that's 1 mile. And if you do that every day, you're not going to be obese, but you also got to eat, properly. Um, the African American diet is terrible. I'm sorry. I love the food, but it can be terrible. And so, as opposed to not eating, just eat less. One of where I worked before at my last employment, my um, my supervisor talked to me about eating 5 meals a day, eating 5 small meals every day. And when I say small meals, I mean small meals. And so, but begin as early as possible with everyone, every male in the family, because as you heard, the risk factors, we are 70% more likely to be diagnosed, and we two to four 20 it's a 2 to 4% higher risk of dying from this. And so I just want to encourage everybody, and I'll answer. I think I can answer any questions. The last thing I'll say is be an advocate for yourself. Be an advocate for someone else. Tell someone else about what goes on. I want to let you know that my MRI was a very there are things that happen to you that bring you down to a particular level. You know, the the examination of your prostate, the anal examination of your prostate is not, it doesn't do well for men. The MRI, I said when I had an MRI for that, I came to appreciate what ladies have to go through in terms of dealing with all the things that they deal with. And so it is just this thing. But if we help each other, if we talk to each other, if we encourage each other, if we and keep talking to people, keep talking to them. If they tell you something and you hear some symptoms in their conversation, you know, we don't, and this is the other thing, this the last thing I'm gonna say. We as men don't talk to each other about these things. Women talk to themselves, talk to each other all the time. Two women will meet each other in a public bathroom and have a conversation about this. There are people that we know that, and we don't talk to them. And so talk to people. If you're a man and you have other men, talk to them. And if you hear any of the symptoms, encourage them to go and begin the process of checking out. And like I said, again, I would keep the doctor's presentations. I would keep that on my phone. This is not like in the old days. We can now put that as a link on the phone, and put it as a message. It can be in messages. It doesn't have to be email. Put it in your messages. I send music to people all the time on my phone because that's what I can do. But so I just want to be encouraged. I hope if anyone has any questions, I'd be happy to answer them. But again, thank you, Doc. You did an awesome job, and thank you, Ms. Aisha, for you all having this program. It's a good program.
Hey, thank you so much, Mr. Romeo. Thank you for just being so open and vulnerable and sharing your story with us. We really appreciate that. We also appreciate you encouraging us to, reach out and, talk to people and to also share this presentation, which is what I will be doing as well because I'm recording it. So it will be available on our YouTube page as well as our Facebook page. So you can go back and
Okay.
rewatch it. You can share it. You can do like Mr. Romeo said. He gonna send it to somebody's phone. So whatever works. But again, just knowledge is power, and I appreciate you. Just for sharing your story with us. So now we are going to get to Q&A, and I know that we had. First of all, does anybody have any questions for Mr. Romeo? And then we'll get to the questions that were put in the chat. But again, I thank you so much. Okay. Alrighty. So we are going to address some questions that are in the chat. I know, Doc, majority of these questions are for you.
Yes, absolutely. I
Good.
think I'll start with a question from Mr. Kenneth. Just it'll be the quickest. He asked what types of medications may increase the PSA level. Very good question. It's
Good
actually
question.
several medications that people actually take quite often. It can be something as simple as aspirin, ibuprofen, naproxen. Those can elevate your PSA level, as well as some blood pressure medications such as like hydrochlorothiazide, as well as patients who are taking like additional testosterone for like hormonal therapy. Now, I want to preface all of this by saying that this does not mean to stop taking those medications. If you are prescribed that hydrochlorothiazide for your blood pressure, please, 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 please take it as prescribed. There is a risk that it can elevate your PSA, but remember that is not an indicator that that is prostate cancer. That is essentially just saying that that is the reason why your PSA may be elevated. Okay. So again, it can be several different medications as well as some medications that are like statins, like simvastatin. These are medications that some people take for high cholesterol. Again, those can elevate your PSA as well. So that's why it's just very important if you do get an elevated PSA to sit down with your provider, kind of go through all of the things, to kind of check all the boxes to kind of see what the reasoning may be, like Mr. Romeo said. Okay, so I hope that helps Mr. Kenneth. And then we had the quick question about is there any correlation with foods and prostate cancer? I addressed this a little bit in the chat. But essentially, there is no specific data that says that, eat this food, don't eat this, et cetera, or you'll develop prostate cancer. And I think that's for most cancers, unfortunately, that there is no pinpoint data as in don't eat McDonald's or don't eat, neck bones, right? That will cause like prostate cancer. I think all of this is saying that a healthier diet and a more active lifestyle in general will decrease your risk for most of the illnesses that are out there, including prostate cancer as well. There's definitely
Amen.
research going on to kind of just give more insight in terms of what may be a contributor, but right now, unfortunately, we just don't have that information. And then I think the last question that I saw on here is, can I provide more information about the biopsy process? Another great question as well. There's typically, I believe, at least two options that I know of, and this is just speaking from an emergency standpoint. Again, your urologist and oncologist would have a more detailed kind of answer for this. But essentially, there's typically two routes. There's one route that's called a transrectal route, where essentially you will be provided like pain medication like the day before this procedure. This is an in-office procedure, but essentially you'll be given pain medication beforehand. also like an enema or a laxative similar to when you get like a colonoscopy, just to make sure that your bowels are cleared at that time. And then the physician will use what's called like a very small camera that will be inserted into the rectum, as well as a needle to take a sample of that prostate. If you all kind of recall the picture that I showed you all, it's right underneath the bladder, but right in front of the rectum. And so it's rather easy to get to the prostate to take that small sample. There is a second technique. It's called transperineal, which is essentially you'll also get pain medication, and you'll also be giving numbing medication. But this is essentially where the needle is essentially stuck through the skin in between your scrotum and your rectal area. So again, you'll get pain medication beforehand, you'll get numbing medicine, and they'll also utilize a needle to obtain a small sample of the prostate. And then, of course, so it's an uncomfortable procedure. It shouldn't be very, very painful. I think just given the area, it's a bit uncomfortable. But again, I think it can be very, very helpful, very important, just on a case by case basis. Any additional questions?
Mr. Romeo, did you have any family history of prostate cancer?
No, I did not. No, it did not. Um, so this is another issue. I did not touch on this, but this is another issue about just diseases for our community. Um, so I did not know my father, so I have no idea of my father's history. I don't have any idea of my father's family history. And so what that does is, that puts you in a situation where you don't have that you can rely on. It's nothing paternal for me. All of my family history is on my maternal side. And so I know, all of the men on the maternal side. But so that's a problem because people pretty much every doctor I go to, they ask you about your family history, and I have to say I don't know. So that means there could be family history, of prostate cancer in my family on my father's side that I don't know anything about. So
Gotcha. Thank you for that. And
and
Dr.
I'm
Okay, go ahead.
sorry, I want to also add something else is that, back in the day, um, or in my generation, my parents, grandparents, so to speak, they didn't talk, well, they didn't know, I think, a lot about what was their medical histories. They really didn't know that in terms of what they was shared with them. And so I did not get a lot of information from the maternal side about the history. I knew I got it from the ones that I knew. I lived with my grandfather. I lived with my uncle. Those were the two that I know. And, I don't even know what was the cause of their deaths because they didn't really tell me or they didn't discuss their history with me. And so ask the family. That's, and when you go to the family reunions, ask her, so what happened to Big Mama? How did she pass? Because that gives you the help. So I'm sorry.
No, you're fine. That's an excellent point. A lot of us do not know our family history, unfortunately. So that is very important for us to find out while we can. Absolutely.
Yes.
So, Dr. Campbell, can you please explain what the normal PSA number range is
Mhm.
and when it becomes what would be the number that says it's elevated?
That is a very good question. A little bit of a difficult question to answer just because it depends on the type of PSA test and
Yeah.
different hospitals utilize different values. So I typically don't like to give an actual range per se, just because I don't want to be misquoted. And then one hospital, like for example, University of Chicago uses a different threshold as I'd say compared to Rush or Cook County. But I think the important part is to get your baseline if that's something you're interested in, and then go according to what that hospital's quote unquote normal is, just because different tests give different values. Like, for example, University of Chicago, a value can be less than 2, right? That can be normal. Whereas, like at Rush, it can be less than 8, and that is their normal just based off of the particular test brand that they use per se. Okay. And like Mr. Romeo said, also the repeats in terms of if it's rising or not is the most important as well.
Thank you so much for that.
Mhm.
Great information. Are there any other questions from our audience? Other comments, Mr. Romeo?
Oh, I appreciate the opportunity, and I will be checking in more to your offerings, and just checking in. We talked the diabetes. I will be checking in on that because I am working on uh, trying to normalize that, and it's just not the easiest thing to do. I don't know, it's just not easy because I don't think I abuse food, but that's all that I have, and that but it continues to be a problem for me, and so it's I look at everything that could. This is the other thing I try to do. I'm willing to read anything that I think that will help. I'm willing to have any conversation that I think would help because I am at my age. I want to do everything that I can to prolong my life simply because I have children and I have grandchildren. So, I have sons and daughters and grandsons and granddaughters. And just I just want to be around.
Absolutely. And I'm sure they want you around. So keep doing what you're doing, keep learning, keep getting the resources. Again, workshops like this are definitely things that we will continue to do. That's our main focus is to provide these type of educational sessions, to everybody. Our reach is very vast, by doing it virtually. So anybody can, get this knowledge. So again, I will also share with everybody who's on here once I do the follow-up email. We do have a newsletter as well that comes out bi-weekly that lets you know about upcoming events, health and wellness tips, etc. It's a lot. It's great, so you can definitely, sign up for that as well as follow us on social media. So those of us who are into Instagram, Facebook, YouTube rewatches. So we're here to provide as many resources as we can. So I appreciate you being here again to share your story. I'm hoping that everybody on this call definitely, garner some information from both you and Dr. Campbell because this is amazing. So I appreciate you both. So, are there any other questions before we get to our live raffle? I don't want to hold anybody any longer than we have to. So, yeah. So if you'd like, you can do the survey, which my colleague placed in the chat. But if not, if you don't get to it, then please know that I will resend it out in our follow-up email. So no need to try to rush and do it now. You will have a chance to do it. And again, with the survey, it's something that we want to hear from you, what you thought about this workshop. What are your suggestions for upcoming, topics that you'd like for us to speak on? So it's time for, we want you to feel engaged and feel that and know that you're heard. So,
Can I one a small plug
sure.
and a small plug because I also have the blessing of knowing my primary care physician is um, an African American woman. My um, doctor, my doctors I get as many gastro doctors, were African American men. Um, my Dr. Youngkins has passed away many years ago, but I currently have an African American man as and I've had the experience of seeing Dr. Campbell work, and I want to just say, Doc, be encouraged. Continue to do what you're doing. You have a good manner. Manner is important. Sometimes all kind of things happen in hospitals, and I think that one of the things that goes on in medical facilities is that a lot of patients the people who treat patients and patients don't talk the same language, and they don't have the same um, there's not the same understanding about, and so people don't tell doctors what's really going on with them, and doctors don't probe because they don't have time. So that's part of it. But I just want to say, Doc, I've seen you work, and thank you very much. You're doing a great job.
Thank you so much. It's my pleasure. Thank you.
Thank you for that plug. That's really great to hear. And, Dr. Campbell deals with a whole lot. So, again, just being able to relate and talk and listen and build that trust, which is something that's needed that, a lot of patients don't feel that. So they don't feel the need to divulge or try to establish a relationship because the trust isn't there. So we appreciate you for that. So thank you both. I'm going to go ahead and pull up our get this raffle going really quickly so that we can let everybody go. Wait, hold on a sec. And while I'm doing that, if there are any other questions or if my teammate wants to say anything, feel free. Otherwise, I'm gonna get this going for us. Okay. So really quickly, that's Dr. Campbell. Okay. So again, the survey, which was put in our chat. And again, if you don't get to it right now, you will have a chance to do it later on. And again, we'll be announcing upcoming events soon. We have a lot going on this summer. So be on the lookout for a lot of community engagement events as well as some large scale events. So we want to go ahead and spin. But again, please follow us on social media, Facebook, Instagram, and YouTube at UCM Urban Health Initiative. And this is our contact information. Again, this will be shared in follow-up email. If you would like for us to speak at an event, you'd like for us to table an event with resources, just reach out to us and let us know. We'll do our best to be present. And again, thank you all. So let me pull up our wheel. Okay. Alrighty. So everyone that's on this call, your name should be on here on the wheel. If you don't see your name, please let me know so that I can add it. But I think I have everyone. So I'm going to spin. And we have our winner, which is Ronald. Ronald, you're still here on the call. Very good. Okay, I'm going to close this out. Very good, very good. So again, I just want to thank everyone for joining us this evening. Thank you all, and be on the lookout for additional resources to come. We hope to see you guys on the next virtual in-person session, whatever we have coming up. We hope that you all will continue to support these type of events because again, it's our, passion to share with you as much information, vital information as we can. And it's free. And then you get to talk to the doctor and, spend time, usually with the doctor, you in and out. So to have these type of sessions, to be able to connect with doctors, this is amazing. And to hear the stories of real life people who are dealing with things. So I appreciate you all both. So for everyone on this call, thank you so much for joining us this evening, and you all have a great rest of the evening. Thank you so much. You're welcome. And Mr. Romeo, I'll be in contact with you and Dr. Campbell as well. I'll shoot you guys something afterwards, okay? All right. Thank you so much. Have a great evening, everyone. Bye-bye.